All right, everybody, thank you so much for joining us today. We have quite a few people on and really excited for the content. My name is Shelly Avery, and I am joined by Josh Thompson and Vasu in our team in the background here. So if you hear other voices, we also have Aaron Porsondak from Microsoft and Annie Mathis from OSF. We are, again, so excited to have you all here today. Before we get started, I do want to just have a couple of housekeeping items. This is an interactive session. So please ask questions. The OSF team is here to really share what they have learned throughout this process. So please, put your questions in the chat and let us know how we can engage you better. Also, this is going to be recorded, so if you love it, which we know you will, it'll be posted later so you can share it with your peers or out on LinkedIn or in your social circles. So now on to how to engage in the Q&A. If this is your first time or it's been a while, we just want to give you a refresher. Up in the top right-hand corner, there is a little question box, and so if you open that up, you'll see a little chat panel come out from this side, and you'll notice that we've made a couple of announcements there. We'd love for you to engage in the chat and let us know where you are joining from, either city and state or country, or even what organization you are represented from. So Josh and I are both representing Texas. Josh is in Dallas and I am in Houston. We have some North Carolina representation as well. I was on with someone from Kansas City earlier today, and they were totally decked out, ready for the Super Bowl. So love to see if we have any Super Bowl fans out there. All right, so we are going to move on to the presentation. We're so excited to let Annie tell her story today. Really going to focus on how OSF Healthcare is providing value to their patients and to their care team members using virtual inpatient care. We had a couple other people, Ryan, Brandy, and Andrea, that were really key in this project. Ryan and Andrea were not able to join us today, but we wanted to make sure that we highlighted their names as they were integral parts of the project team. And with that, Annie, I would love for you to introduce yourself.
Okay, so I'm Annie, of course. I have been with OSF for about 3 years in my current position as project specialist. And so I manage projects where we help to design and implement solutions across our healthcare system that ultimately help improve our 5 stars. So that's a rating system for healthcare organizations. I'm just going to talk like I'm speaking to people who aren't clinical. I'm not clinical, so we'll try to use language that's as non-clinical as possible. But that's me, high level.
Awesome, Annie. Thank you so much. We want to highlight the use cases that you have shared with us around inpatient care. As we move over to that, I think it would be great to talk a little bit about how you got engaged with this project and what were some of the primary challenges you were trying to solve for.
Right. So when I came onto this project, OSF Meet had already been selected as our solution. I know that I had previously worked with other solutions in the past, or I had heard about them, and they were not successful in what we were trying to get them to do. And that could have been just because of how they were built. What we were trying to use them for just didn't satisfy our needs. And that created a lot of frustration on our end for our staff, for patients, for family. So we went with this solution that we called OSF Meet. About the time that I came in, we were in what I would consider a design phase. I'm not IT, but to me it seemed like a design phase where we were trying to create functionality within the app that would satisfy our needs for our 3 use cases. So those are virtual discharge, patient to family, and then clinician to family. So I can start with the first one and kind of go over virtual discharge and go over our background, our opportunity there, and just work through it that way, if that's okay, Shelley.
Absolutely. That sounds good.
All right, so virtual discharge background, like why we went that route. So consequences of prolonged discharges are poor patient satisfaction, and then that poor patient satisfaction and inadequate discharge education can negatively impact our hospital reimbursement and compliance. And there's also an impact to the emergency department. So you'll have increased emergency department wait times, delayed initiation of inpatient care, overcrowding or boarding, and then you have more patients who are leaving before they've seen a provider. So that presents us with this opportunity where we could impact our care delivery model through the utilization of a virtual discharge service, that being OSF Meet. And through that service, we were trying to leverage technology to expand our discharge services so we could serve more patients with less resources, improve productivity and efficiency of our labor resources, reduce that nursing workload. That's always a huge issue, and increase our throughput. But also specifically for our patients, just allowing them time to review discharge instructions and ensuring that their follow-up appointments are scheduled, that they have assistance with their prescriptions, and that transportation is being arranged to get them out the door and home more quickly. So for virtual discharge, we decided to pilot at our largest hospital, which is St. Francis Medical Center in Peoria. We went to a 52-bed unit, which is all medical surgical patients. We started with the project team, so that would have been Kaizen, who helped us a lot with the designing of the app and removing any barriers with our IT department. And then we used a charge nurse from that floor. That would have been Andrea, who unfortunately couldn't come today. She was doing a doctorate of nursing practice project on virtual discharge. So it was great to have her kind of as a change champion on the floor. We worked with IT, educators, and managers from the unit, and then just members of a clinical resource team, which is like a nursing pool. Those nurses go to different hospitals throughout our system. And then that team helped with decisions with the functionality of the app, virtual discharge, inclusion, exclusion criteria, how we were going to operate it, like during what hours, and then the roles and responsibilities of unit staff and our virtual discharge nurse. So that virtual discharge nurse is a new role that we had created by repurposing other roles. We didn't want to add any FTEs just in these staffing challenge times. And so that was the person who was really leading the virtual discharge, that virtual discharge nurse. So I want to talk a little bit about the overall functionality of OSF Meet and how it ties into those roles and responsibilities, because I think it gives a broader understanding of what we did, and then it also helps as we move on to the other 2 use cases and explaining how we did things. So OSF Meet, the Clinician app, is something that we created with Kaizen. It's an app that lives within Microsoft Teams. The virtual discharge nurse would use that app to register a patient for virtual discharge for that call that was going to take place. There was obviously communication prior on who exactly would be discharging that day so that the virtual discharge nurse would know who to register, but that's where they would register them. When they registered that patient, they would get a username and password, and then they would communicate with the bedside RN on the unit, that username and password, as well as coordinating a discharge time. When that discharge time came, that bedside RN would go get an iPad on their unit. These units were already stocked with iPads, so they knew how to use them, how to get them out. They would go to that iPad, they would look for Microsoft Teams on the iPad. They would enter the username and password that the virtual discharge nurse had given them. They'd click through a couple of screens, and then they would answer the call when the virtual discharge nurse called them. And then when they got that call, they'd make sure obviously the audio camera was on, closed captioning. They would provide the iPad to the patient along with their after visit summary or their discharge instruction paperwork. And then that virtual discharge nurse would walk them through that paperwork, make sure that all of their appointments had been scheduled for follow-up, make sure their prescriptions were taken care of, and then arrange transport. At the end of that call, if there were any follow-up concerns, they would bring that back to the charge nurse or their bedside nurse as well. I do want to point out that when that bedside nurse would go into the Teams app on the iPad, that app looked different from how it looks to me or to someone else in a business setting. The functionality was a little bit different, which we had designed that way, just due to some security concerns on our end, but did look a little bit different than what we're used to seeing. So once we had created that, we did some training sessions with Kaizen, like kind of a train the trainer. We also put out huddle notes and tip sheets on how to use the overall app. And we set aside some testing days so that we could test and see how that app worked, make sure that everything was good to go prior to the pilot. So when we went live, there was honestly really minimal IT issues. If there were any, I don't even remember what they were, which is great. That doesn't usually happen, at least in my experience when you're working in an IT space. I was also on the floor when we went live for the first few weeks with my team as well, just so that we could really get some feedback from the staff, from patients, really hear what concerns were, and then help escalate those barriers. So just some general takeaways from that pilot, our results. So we served over the course of our pilot, it's about 2 months, roughly 150 patients. We were looking at order to discharge time as one of our metrics. And so we were able to improve a portion of that metric, which was order creation to order release. We were also looking at a metric gauging patients, how the quality of the virtual discharge education that we were giving. And so to do that, we asked patients to do teach back. So we asked them to describe the use of one of their medications and when they should call a doctor. And so they were able to complete teach back 98.3% of the time, which is incredible. And then we also tried to ask about their overall experience with the app and the virtual discharge process. So we asked patients on a scale of 1 to 10 to rate their experience with OSF Meet in the virtual discharge process, 10 obviously being fantastic. And the average response was 9.4 out of 10 for those who were surveyed. So just some of the initial feedback that we got, some direct quotes. It was great how immediate the questions that they had were answered. So those were answered by the virtual discharge nurse. It provided them an opportunity to get all of their questions answered. It was organized, simple, and quick. And that it was a great process because the education was more thorough than previously experienced. It also made their discharge quicker. And that the discharge was much more efficient than that patient's previous stay. So those are just some things we'd heard from patients. With regards to bedside nursing, we initially had some pushback from them. I don't think that that is surprising. Anytime you implement any kind of change, something new, there's a lot of pushback. Our nurses are also burned out just with COVID, with being understaffed. It's just another new thing. So when we initially had that feedback, it was great that we had a change champion on the floor through Andrea and the educator and the manager, because Andrea was really able to walk through the process with those bedside nurses and show them, hey, this is really simple. It's going to save you time. And so after she had done that a few times, we got a lot more buy-in, and we started having those bedside nurses doing those discharges virtually more regularly. And so some of the feedback that we got from bedside was that they did not have to do anything for discharge, which provided them time to complete other patient care tasks. And experiencing that pilot and going through the steps with Andrea, they were able to better understand the why. They felt like it was saving them time and that the process worked well, and that they would love to be able to provide the level of discharge teaching that had been given to their patients, but that they just didn't have time. They were really impressed by the discharge education that our virtual discharge nurses were providing. So that was virtual discharge, our overall results from that one.
That's awesome, Annie. Thank you for walking through that. So while I give time for a few more questions, there are two that that we've got so far specific to this solution. So the first one that I want to ask is a question around what is the EMR platform, and they're wondering if you can repeat some of those metrics. So like the teach back metric, there's 98% in change, awesome. There's some of the satisfaction metrics. So would you mind speaking to that EMR platform that's used, and as well as just repeating some of those success metrics that you tracked?
Yes, so they use Epic. They were communicating with the virtual discharge nurse through secure chat with an Epic. just as an added thing in case anybody was wondering. So some of the metrics that we were looking at, we looked at order creation to order release, and then order release to discharge time, and then the overall from order creation to discharge when that patient rolled out the door. We also looked at quality of the virtual discharge education, and we did that by doing teach back. So those teach back questions that we used, we had tried to pull them from, I believe, surveys that go out. We had pulled them from somewhere, I don't quite remember where, but they were questions pertaining to describing the use of one of their medications, why they are on a certain medication and what it does. And secondly, when they should call the doctor. So depending on like if they have a fever or any kind of symptoms going on, when they need to follow up with someone and be like, hey, there's an issue going on. And then we also looked at just their overall experience with the app and the virtual discharge process. So that was something that we asked the patients. We had them rated on a scale of 1 to 10, their experience with the OSF Meet app and the virtual discharge process, 10 being the best experience. And then the other, their comments or things that we individually asked them through support calls or in person.
Okay, very cool. We just got another question. Appreciate you revisiting some of those metrics. It sounds like it's been really successful. But a follow-up question is, what's your long-term goal in expanding the program? Based on your studies, would you use charge nurses for scaling to other departments?
So this is something that we've talked about a little bit, and I think it's still kind of up in the air just due to staffing concerns in terms of how we would spread it, which is kind of where we're at now, talking about how we would make that work on a larger scale. We've talked about repurposing certain roles to take on the virtual discharge nurse role or pulling out FTEs from the units because they would no longer be having to do discharges, skimming some of that off to create a new role potentially. That's kind of how we've looked at it. But those are conversations that happen above me, so I only know what I'm told. Yeah,
of course. No, that's hey, we're here to be real, right? So that's no, that's awesome. Thank you for sharing. We're starting to get more questions rolling in, so we'll see how many we can get to, but this is really cool. So one question was, and maybe we can pair it with another one, but we got two questions. How long did, oh, sorry, it just moved out of the way. How long did the virtual discharge process take on average? And maybe we can couple that with another one, which, what was the solution prior to this solution, and what were some of the challenges and limitations of those? So maybe can you talk about kind of previous state as well as maybe how long that discharge process took on average previously?
Yeah, so for the virtual discharge nurse, what was great with them is that some of the nurses that we were using, that hospital has a discharge lounge, and so they're used to doing this, but they have the patients come down to them in person versus doing it virtually. So we had like a good baseline of how long things would take. I think that they had said it would take about 45 minutes to typically do a discharge. This went a little bit smoother. I think that they were usually about 30. I mean, I sat in some too that were 10 minutes. I sat in quite a few that were 10 to 20.
Okay. Awesome.
And then platforms that we had used before, I think that was the question. So one of them, I don't think that it necessarily pertains to virtual discharge, but maybe the other ones, we used something called EASE. That was a pilot that I was a part of. Trying to think of like where to start with EASE. It was a lot of errors would come up when you were using it. I'm trying to remember because this was back when we were like full COVID. And we didn't have any visitors. So we were really relying heavily on this app to connect people with their family. There would be a lot of errors with trying to like make the connection. There would be issues a lot for the family trying to get their side of the process to work. They had to download an app They had to like do some steps on their end that just wouldn't work. And so a lot of times what ended up happening is it would just be so frustrating that people would start using Facebook Messenger, which is a security privacy concern. Obviously, we can't be using Facebook Messenger. So that was why we couldn't go with ease. There were a lot of issues with it just not functioning and causing just being painful for the family. I was in pain trying to use it. So.
Well, it sounds like a big improvement. Thank you for taking the time to answer those. A quick one. Oh, go ahead.
Brandy, I'm not sure if there was other things that we used. I hear of things, but I don't know necessarily what they're used for. So I don't want to say that we had tried to use it. I don't think we've tried to do a virtual discharge solution before that I'm aware of.
Okay, no, that's helpful. Another question was, where were these patients going home? Were they going to a skilled nursing facility or someplace else? Did it vary from patient to patient, or?
Yes, so one of our excluded, so I'll go over our inclusion/exclusion criteria because I think that will help. Those who we excluded from virtual discharge are patients who are discharging to a skilled nursing facility, just due to the number of, I guess it's a different process in terms of how you manage those patients. We hadn't quite figured out how to work them in. Patients who could not read or had a visual disability, patients who required interpreter services, patients who are hard of hearing, and patients who were confused with no caregiver available to participate. And then we tried to prioritize certain patients. So we had those that were excluded, but then the ones who were available to use this app on, we tried to prioritize non-case management patients because we could get them out the door more quickly. Patients who had a ride present, or patients who could not physically go to the discharge lounge. So those would be isolation, draining wounds, incontinence, mobility difficulties, those kinds of things.
Okay, awesome. We had a couple questions specific to the solution, and I wanted to tee up Shelly Avery actually to kind of speak to that a little bit, because I think she's got something that she wanted to show. So Shelly, would you mind just stepping in here for a second?
Yeah, for sure. And hopefully I can summon my inner Ryan and Kaizen team. Annie, I know this is kind of ad hoc, but this is an image of the original non-OSF solution. People are just asking kind of like questions about, kind of how does it look or work. And so we wanted to be able to show at least a visual to the folks out there. There was one specific question around, is there a video visit actually used in this solution, or a video meeting, or was it just through secure messaging? And so just kind of wanted to show this. The top image is more around what like the nursing or a physician or clinical team could select the correct patient room. And then the bottom image is more around what the bedside leader or nurse with the patient would use. And then they would both be able to join in a virtual visit. And so the OSF solution probably looks a little bit different than this because it is fully customizable. But again, just wanted to give kind of that generic visual overview of how the solution looks and what people might be able to expect if they wanted to start with the template.
Yeah, I can like see where our stuff would fit in based on this template. It was set up in a very similar way. Just obviously, like our location would have been our hospital, and then the sub-location would have been the unit that we were on, and then the patient's room or their name.
That's right. Awesome. And then there were a couple of questions around being able to extend this to people outside of the unit or hospital. And I think that goes towards your third use case around extending to patient or family. So would love for you to talk about patient to family and clinician to family, and kind of how that worked for OSF.
Yeah. So once we had made sure there weren't really any bugs with virtual discharge, that's when we went to patient to family, clinician to family. We piloted those at the same time. So patient to family, we're really looking at that opportunity as offering this virtual connection for patients who don't have that ability or opportunity to connect with their loved ones in person or through a virtual means, because they don't have a smartphone or smart device. And so that could be a pandemic situation, someone who doesn't know how to use their smartphone because they're confused or they're not tech savvy. It could be to connect someone who also doesn't have a smart device, like I previously said too. So we piloted patient to family at 2 units at 2 hospitals. So one of those was at Little Company on their telemetry unit. So those are medical surgical patients that are typically cardiac in nature. And then at St. Elizabeth Medical Center on their behavioral health unit. So we did very similar setup to like we've done with virtual discharge with our project team and pulling people from the units, and what they did. In terms of their helping with the functionality of the app and determining roles and responsibilities. And so with patient to family, the way that app functions is so you have a staff member. They go into the clinician app, just like a virtual discharge nurse would, but that staff member is going to register the patient for a family visit, a virtual family visit. So they'll go into the app, they set up a meeting time, and then they enter in their loved one's information. So it's like their email address, their phone number. And what happens when they save that is that it will send say that they went the telephone route. It'll send their cell phone a message that'll have a meeting link in it. And it'll say like the information, the meeting information, so that they know when to join. So say that your meeting is at 1 o'clock. So the family member could click on that link. It would bring up the Microsoft Teams app if the family member already had that app on their phone. If not, it would direct them to downloading that app in the App Store. They would download the app. They would go back into their message, click on the link again, and that link would bring them to Microsoft Teams. They would join as a guest. They would enter their name, and then they would just join the meeting. I think that they could join like 30 minutes before the meeting. And then on the staff's end, what they would do for patient to family is then they would go get their iPad. They would take that username and password that they had gotten when they originally registered the patient on the clinician app. They would log in, and then they could join the meeting, and that family member would be present in the meeting as well. I hope I did. I was trying to make that sound as simple as it was. It was incredibly easy. In this case, so at Little Company, where they had that telemetry unit, they did not identify any opportunities to use OSF Meet, just with in-person visiting, and they had people who could use their smart devices. Where we really had the most use was at St. Elizabeth on their behavioral health unit. What was cool about the behavioral health unit is that you have patients there, they cannot have smart devices as a behavioral health patient. They also have greater restriction with in-person visiting than other units. So they might have set smaller windows of time. They can only have one person at a time come in sometimes. And then because we only have so many behavioral health units across the state, there are only so many places that a patient can go. So you might be very far away from your loved one who is staying on a behavioral health unit, and you might not be able to visit them, or not as often as you would like. So on those units, they did this visiting 2 days a week with their staff member. They had 11 successful OSF Meet connections. And so with them, what we were looking at for metrics were family experience and staff experience. So for the family, we asked them on a scale of 1 to 5, how easy was OSF Meet to use, with 5 being the easiest. The average response was 4.8. And then on a scale of 1 to 5, how connected did you feel to your loved one, with 5 being the most connected, and the average response was 4.7. Overall, family comments were just about how easy it was to use. They were glad to have the opportunity to connect with their loved one, and that they felt like they didn't need much help from staff in trying to get onto the app, which was nice. And then we also asked staff what their experience was in using OSF Meet, and they their average response was a 5, obviously 5 out of 5. It was very easy to use with no problems. Their patients and families liked this, and then it improved their patients' experience. It gave their patients another way to keep in contact with their supports, and this improved their mood and their overall stay. That was patient to family.
It sounds like there were really a lot of satisfied people with it.
Yes.
Really awesome outcomes that you have there. I'm excited to hear.
So I can hop over to Clinician to Family really quickly because it works pretty much the same way in terms of the overall functionality of the app. With this case, we had 2 instances where they were able to connect virtually. And so they were using this. So this was done at an ICU at Little Company of Mary. And they were using this Clinician to Family for discussions on plan of care, code status, any procedures that the family needed clarification with, or meetings where family participation was needed, and also just to give family members the opportunity to see the patient if they weren't able to. For our 2 successful uses of OSF Meet at the ICU, those were tested with family members who were immunocompromised. One of them was a cancer patient. And so that allowed them to participate in their loved one's care when they would not have been able to otherwise, obviously because they can't be in the hospital just due to their condition. And so again, we asked them the same questions as we did with patient to family. How easy was OSF Meet to use for the family? And the average response was 5. 5 obviously being the easiest. And then how connected did you feel to your loved one's care? And they had said 5 out of 5 as well. Overall comments, just that it was easy to use. It was nice to feel involved in their loved one's care, and also to see the care team when they would not have been able to otherwise because they couldn't come in. And staff experience was also a 5 on how easy OSF Meet was to use. They were very excited about being able to use that and connect people for those kinds of visits. Yeah,
really awesome. Yeah, experiences there. I think a lot of folks, as Annie, as you and I, were prepping for this, we have a lot of our provider customers that are very interested in either virtual nursing, virtual rounding, or even kind of this third one you mentioned, somebody external from the hospital, like a family member or a loved one, being able to connect in to hear either that virtual discharge or really just to hear, the physician give an update on their care, the status. Very interesting how you're saying how easy it was or how satisfied the family members were with this. Can you talk a little bit more? I mean, what were some of the prep that you guys did, or did you have to educate the family ahead of time? Because a lot of our customers are asking us, like, how do we make it super easy for people to join? And it sounds like it is easy for them. Can you talk a little bit about that?
So what I had done for the staff, I had printed out, put together a tip sheet basically so that they could help walk family members through it the first time if they needed that help. I think it's where you run into most difficulties with people who maybe aren't very tech savvy. I think that they had to help one time at a patient to family connection at St. Elizabeth, where they were able to walk them through it. It was somebody who was older, but very, very intuitive, very, very few clicks, which people like. And a lot of the links would bring you right where you needed to go so that you weren't having to go look through and find your app store yourself and type in Microsoft Teams. Just having that link bring you to where you needed to go to download it.
Awesome. Okay, we do have another question from Brian. Can you talk about any documentation that happened during these? Did it get pushed back into Epic, or were they putting notes in this app, or did they just kind of do swivel chair where they took notes in the EMR and then use the OSF Meet just for the virtual visit? Maybe, do you know that level of detail?
So this is what I think the question is, what I'm hearing you say. So they couldn't document anything within the iPad. into the patient's chart. So what they would be doing is just charting separately within Epic. That makes sense.
Yeah, I think that was
the root of the question. Aren't set up that way. Yeah.
And then there was a question from Charles on the example solution that we showed. So I'm just going to switch over to that. It says, does each patient room becomes a Teams-enabled room? And can those also rooms be used for the patient to communicate with their family members that are unable to be with them in person? So I'm not sure how OSF did it, but each of those rooms, they don't become necessarily like Teams rooms. They become a virtual Teams meeting in the background. Right. So that hopefully that answers your question, Charles. But I guess from an OSF perspective, Annie, could the patient use OSF Meet to communicate with their family members, outside of a clinician helping them, just to be able to connect for more of a, like a visitation?
Yeah. So when that staff member initially registers the patient in the clinician app, and they're adding family members for the meeting, there is the ability for that patient to just call family ad hoc, where they don't need a meeting. They would just go in there, and they would hit there's a little telephone sign next to their family member's name who they want to contact, and they could call them that way.
Wonderful.
I know that, so the way that our healthcare system works is not every bed has an iPad attached to it. I think that some hospitals do. So for us, it was really based on the number of iPads that we had available, which I think we have, 15 on a floor, but otherwise you could give everybody an iPad and they could use it that way. But this was more of, we had to give them the iPad first and then get it back.
So the iPads are being passed around from one room to another room as the demand needs dictates. Got it.
Between each meeting, we would have to put it back into the kiosk to clear it for security or privacy related concerns, to wipe it. I don't know what that means from an IT standpoint, but that question has come up before in terms of how we were managing that.
Yeah, makes sense. I also assume there's some physical cleaning of the devices as well. Yeah. Well, I think we have got through all the live questions, and you have hit on your use cases. Any final kind of comments or any kind of advice you would give someone else kind of in your situation that might be starting to endeavor down this path?
I think that one of the biggest things that I would hear from people when they would initially do the train to trainer, or just initially coming in with any kind of new solution, so they were very worried about what it would be like when they were actually executing it. And what we heard from every single person who did is that it was much easier when they were actually doing it than when you first get all that education thrown at you at once. Even I was surprised when I was doing it. It is very, very simple, and not just being part of things that have not been very simple, or that have had a lot of where you're having to instruct family on how to do things or patients on how to do things. It's very nice to have a simple, clean solution.
So it seems a little bit more overwhelming than it actually is. So you're saying just try it and not worry about it as much.
Yeah, I think that. And I think it's that way with any new thing that comes along. It's just something new and you're getting education and it seems like a lot. But then when you're actually doing it, I try to explain things as simply as they were. I'm not understating anything. Very simple to use. And I think that it's very important for our frontline, just being so overwhelmed and overburdened with a lot of things, that they just have something that makes stuff easier for them.
Awesome. Well, Josh or Aaron, any final questions that you have for Annie that you think our audience might want to learn from the OSF experience?
Thanks, Shelley. I've got just
Yep.
one, and Annie, maybe you have covered it, maybe not, but did you talk at all about like what the future might look like for these solutions? Like as feedback come back from the care teams that have maybe caused a need for you to look at like a version 2, so to speak, of the solution?
Yeah, so we have talked about trying to expand primarily with virtual discharge, and the issue that we've been running into is staffing and how we're going to staff it, and we have so many staffing issues as it is. That has kind of been put on the back burner for right now. I know that they're trying to move towards obviously a lot more virtual solutions, not even just virtual discharge, but virtual admits and those types of things. So I know that those are on the horizon. I just don't know when they're going to be. I know we're not trialing anything else for virtual discharge.
Great. Thank you, Annie.
I don't have any additional questions. I think it was a great presentation. I've seen some really positive feedback in the just through the chat. And so, you know, Annie, thank you so much for all of the dialogue today. I wanted to just remind everybody, I put it out there in chat, but we've recorded this, and so you'll be able to go back through the same blog page and just check out the recording so you can hear Annie again and some of those metrics that they saw success on and how they went through this whole process. So that's something else that you can review after the fact. Shelley, I don't have anything else unless you do.
Yeah, just want to give everybody a heads up. We do have a new session already scheduled. We'll be posting information about it here in the next week. But on March 1st, we're having Advocate come and present on how they have successfully hosted a virtual nursing conference that they feel is actually more beneficial than having it in person. And so this year they're going to be using virtual and in person, using a hybrid kind of session. And so on March 1st, would love to have you guys come and hear from Advocate. And then we also have a podcast that's going to be coming out around how 2 different physicians from 2 different hospital systems are using technology for asynchronous and virtual care. And so would love for you guys to be looking out for those. And then our final announcement is we do have a form. The link is posted in the chat and on the blog page. If you would like to receive these sessions in the future on your calendar, please just go put your email in there. You can always unsubscribe, and this is the only communication we will send to this list. But if you want to get these on your calendar invite, go ahead, fill out that form, and we'll make sure that you get upcoming sessions on your calendar. Thank you, everybody, for attending today, and hope to see you next time.
Thank you.